Shh. Bosla. Hey everyone, thank you for joining us. Get your questions ready. We are talking about body contouring procedures, which includes the mommy makeover, breast lift, thigh lift, arm lift, Lapo 360, BBL, my signature procedure, the drainless tummy tuck. So thank you guys for joining. Go ahead and get your questions ready. Share the link with your friends. Let them know that we are live taking some questions. And happy to give you some insights on what to do to get ready for your body contouring procedures and getting ready for a plastic surgery. So we're going to take about an hour. I usually do these Q&A sessions every Tuesday and Thursday, usually starting at 7 p.m. Central Standard Time, so Houston time. As long as time permits, I'm available. If I'm not operating or traveling or otherwise occupied doing other tasks, always happy to be able to tune in and get you guys ready for your procedures. If you're not following us, by all means, go ahead and follow us, Deigni Plastic Surgery, like our TikTok channel. Put in your information in the bottom of the screen there. There should be a form that you can fill in. Let us know what procedures you're wanting to have done. And my patient coordinator will be happy to contact you and give you some estimates of what to expect your budget will be depending on what procedures you're wanting to have. One easy way to actually get a hold of us is just to text us. Call us or text us during business hours. You can text us 24/7 and we will get back to you. 281-724-3138 is our phone number. We are located in Houston, Texas. Again, I'm a board certified plastic surgeon and I practice in Houston, Texas. I specialize in body contouring procedures. And that includes everything to, restore the function and the beauty of your body. For example, this patient who you can see here has had a drainless tummy tuck. She came in complaining of, having a lot of excess skin and some protrusion of her belly. So kind of like looking like she's pregnant, even though she's long been done having kids and has been, pretty active, but not able to actually transform her body the way she wanted to. So she came in for us to examine her, and we discussed the drainless tummy tuck with the monsplasty, so to be able to restore her fupa area as well. And what we did was a beautiful drainless tummy tuck. When I do my procedures for the tummy tuck, I don't place drains because I use a specific technique that actually allows you to have a much faster and easier recovery than the traditional technique where you place drains. And so my patient is seen here about 6 weeks after her surgery. She looks fantastic and is really loving her results. By that time, she's already walking upright. She's got a nice flat belly. You can see the difference in the before and after, with also the emphasis from her beads. So she wears beads around her belly. In her before picture, they were stuck way above her belly button. It wouldn't come down. So now that we've actually done a tummy tuck, she's wearing those same beads, and you can see them come way down on her waist level by her belt line. This is her bikini line, and the scar is nice and low and very well hidden. So when she wears a bikini or a bathing suit, you're not able to actually see her scars. So definitely contact us, come and see us. I know you guys ask a lot about the recovery process for these patients of mine. They do extremely well. On average, most patients will be off their pain meds around 3 to 5 days after surgery. They're typically walking upright, not hunched over, but coming upright, standing up straight, and are able to go back to work usually a week, 7 to 10 days after surgery. They're back to work. If it's desk job, nothing that involves any heavy lifting or pushing or strenuous activity, they're able to go back to work. My patients will usually follow up with me about a week after surgery. So that's the first appointment. And then I'll be seeing them regularly throughout 6 months to make sure that they heal well. So the recovery is very quick, and all of our patients are extremely pleased with the results. All right, Joe Stein is asking, I was informed that I need a paniculectomy. Do you take insurance for this procedure? Great question. Our office does not take insurance. We perform the paniculectomy, but you will be paying out of pocket, and you can verify with your insurance if they will reimburse you directly. I've operated on other patients before who've been in that situation, and they've been able to contact their insurance and get some reimbursement through their insurance directly. But if you want me to be your surgeon, I'd be happy to. I don't do any drains. I do a specific technique to actually minimize that need for any drains at all. So I don't place any drains. Makes your recovery a lot easier and smoother. If you qualify for a tummy tuck, I would recommend that you get the full tummy tuck, because you'll have a much better result than just a paniculectomy. But come and see us. Text us 281-724-3138, and we can start the discussion. JMJ, I want a BBL. I am in San Antonio, Texas. BMI is 24. Is it likely you could get 5 liters from me? I want a fat butt. Okay, so with a BMI 24, I'm not sure we'll be able to get to 5 liters of fat. That would be a little over the top. I don't think you have 5 liters of fat to give, but we can definitely get as much as we can to give you as big of a buttock area and hip area that you can have. Now, not everybody is going to be able to accept 5 liters, even if you had it. Your tissues have to be able to accommodate that volume. At some point, most patients will start spitting that fat out. And so to get a really big change in the BBL, it is very common to have 2, if not 3 rounds of BBLs to be able to get to that point where you see the really, really big differences. So, but definitely, we'll be happy to take care of you. You're in San Antonio, Texas. It's not far at all. We get patients from all over Texas and San Antonio. We definitely get people from there as well. So come and see us, and we'll be happy to take care of you. We can start the consultation with a virtual appointment. And so you don't have to necessarily drive to Houston or fly in if you're out of state or even out of the country. We will start your process with a virtual consultation. You will send us some pictures and fill out your medical history, and then we will get the ball rolling. User long number. Hello, it's nice to join live. So the person have to have a certain BMI to do the procedure. Yes. So the max BMI for these procedures is 35. Ideally, I would like for you to be at a BMI between 28 and 32. For those of you who really want some fat transfer, that is a BMI where I can definitely find the fat and give you pretty much all the fat that your body will be able to handle. We may have some fat left over, but definitely, ideally, I would like you to be between that BMI of 28 to 32. Max BMI 35. Otherwise, we'll be happy to take care of you. Yeah, you're very welcome, Joe Stein. Thank you for participating. I appreciate that. Don't hesitate. Just text us, call us, leave a message. That's the easiest way to get a hold of us, and we will be happy to take care of you. Sue Ren, is it possible to go from 35 waist to 26 with liposuction? I am not sure. I am not sure if that is possible. You may have a lot of loose skin that's left, so you may actually need some skin excision procedures on top of the liposuction. Zola is asking, do you do rhinoplasty? No, I don't do rhinoplasties. I do very, very specific cases in rhinoplasty. If you want to get your hump reduced, I can do that. Anything more extensive than that, I would refer you to a rhinoplasty specialist. So if it has to do with, really reconstructing your nose, changing the tip definition, putting in grafts and things like that. So there are definitely plastic surgeons who specialize in rhinoplasty, and that's who I would recommend that you go and see, because you want somebody who really does this day in and day out and just very, very regularly. But I've done some rhinoplasties, and it's just very, very specific and small rhinoplasty patients that I do. So in general, no, I don't do rhinoplasties. T, how long is a patient under for what the patient in the picture has received? Okay, so on average, the drainless tummy tuck will be anywhere between 2 to 3 hours, depending on what surgeries you've had before. If you've had a lot of, thank you very much for the ice cream cone there. I appreciate that. If you have had previous liposuction, previous surgeries, and there's scar tissue, that will depend kind of like on how long it takes. But on average, it's around 2 to 3 hours. It's the same day procedure. You leave the facility once we're done operating on you. Usually it takes about an hour to an hour and a half for you to recover from it, get awake enough to be able to leave the facility. Great question. For pricing, anybody who's asking for pricing, please go ahead and contact us. 281-724-3138 is the number to text, and we will be able to, so text us your name and what procedures you're interested in, and then we'll reach out to you and give you some more information. JMJ, do you do reverse tummy tucks? I have done reverse tummy tucks. It's not something that is common, but definitely come in and we'll see if that is a procedure that you will benefit from, and then we'll see if we can accommodate that for you. Oh, let's see. Elizabeth is asking, is there any lipo included in any area with your tummy tuck procedure? No, so the tummy tuck procedure is just the tummy tuck. You're welcome to add liposuction as well. And so that would be liposuction with a tummy tuck. And we do that very, very often. So the most common procedure is lipo 360 with the tummy tuck as well, if you want to combine liposuction with the tummy tuck. But you're welcome to add that to the procedures. Absolutely. Slaying Your Way by V is saying, oh my God, I need this so badly. Okay, we will be happy to take care of you. Definitely contact us, 281-724-3138, or put in your information in the bottom left of the screen there. There should be a form, and we will get in touch with you. Visca186, I texted, but no one called or texted back. Please text us back. If you haven't heard back from us within 2 business days of you texting us, definitely contact us again, and we'll make sure that we respond, because hopefully the text went through. But sometimes there's issues with phones and applications, apps that don't work. TikTok, we've been having some issues with them for several weeks now, so that's why I definitely included the phone number, and I want to kind of like cover our bases, because if there are issues with the apps, it's hard for us to know whether or not you've contacted us. So please don't hesitate, contact us, call us multiple times if you haven't heard back from us or received any kind of message back from us, because it's quite unusual if you text us then we don't respond. Lindsay Reagan, cost of tummy tuck. Okay, for the drainless tuck, that's the only cost that I know. It's usually $13,000 to $15,000, but definitely contact us. We'll get a little bit more information from you to be able to guide you with the process as well, and we'll be happy to take care of you. Now, that price includes anesthesia, facility, and surgeon's fees. It also includes all of your post-op appointments, your pre- and post-op care, and your garments, as well as your scar cream. I have the pharmacy compound-specific scar cream for you to be able to use, and we will have that shipped to you, or make sure that you get it. If you're out of state, we will make sure that you get it during your pre-op appointment with us. User long number. What is the highest BMI that you accept? 35. 35 is the highest. Now, that's blanket statements. I've operated on patients with higher BMIs. It all depends on the specific patient, where they actually are carrying their weight and what type of procedure they want to have. So on a case-by-case, I will make exceptions. But blanket statement, max BMI is 35. Gloria's 14 is asking, can you do a BBL reduction? Yes, that can be done. So if you're wanting to remove any excess fat from the buttocks and hip area, definitely contact us and we will assess you and then see what needs to be done and how we can improve on your results. Text us 281-724-3138 and we will be happy to take care of you. JMJ, thank you. I'm going to come out. Okay, perfect. Looking forward to it. So again, if you guys are not in the Houston area, we have plenty of patients that come in from all over the U.S. and even outside of the U.S. We will start with a virtual consultation. If you're in the Houston area or surrounding area, an hour and a half or so, and you're able to come in person for your consultation, by all means come in. We will be happy to examine you in person. I will be the one that you'll be meeting with, and I'm the surgeon operating on you. So always happy to be able to meet my patients in person and be able to actually physically examine you so I can have a much better idea of what your tissues are like, and we can get you the appropriate treatment plan for you. Mercedes Martinez is asking, how much are consultations? $150 for you to book your appointments, and that money goes towards your surgery when you book your surgeries with us. Thank you. Wonderful. Mercedes Martinez, what are your BMI limits? So max BMI is 35. But on a case-by-case basis, I will be able to determine whether or not we need to make an exception. And I've done that for certain patients. 1985, Gabby 3. How much will it cost, please? So for the drainage tummy tuck, it's usually around $13,000 to $15,000 for the procedure. And you can do a mommy makeover. We add lipo 360. You can add a BBL procedure, so fat transfer to the hips and buttocks. You can add breast lift, breast augmentation, either with implants or with fat transfer, and that will be added onto the cost and the quote of your procedure. You're very welcome. Thank you very much, everybody, for participating. I appreciate it. Don't forget to share the link with your friends. Send us a gift if you would like to participate and you feel like this information is well worth it. We will be happy to reach our goal. Thank you very much, Black. I appreciate that. Let's move on to the next question. Thank you, Erica Babe. I appreciate that. Any questions that you guys have, don't hesitate to put them. I'll make sure that I get to them, okay? Lindsay Reagan, if I do, let's see. If I do a tummy tuck with you live, 3 hours from Houston. Oh, if I do a tummy tuck with you, I live 3 hours from Houston. Can I go home the next day or same day? So 3 hours from Houston, you will most likely stay overnight. Stay overnight, and then you can leave the next day. Yeah. We have had some patients who have left the same day. But again, usually it's about an hour. They live about an hour, maybe an hour and a half from Houston, and they've been able to safely make it back home. But if you're anywhere between 3-4 hours, usually you'll stay kind of like the Dallas-Fort Worth area or around maybe farther out than San Antonio, Austin, because it's about 2.5 hours there. But if you're 3 hours, 4 hours out, usually you'll stay overnight, and then the next day you'll go. Yes. Yes. So the way I do these procedures is to make your recovery as easy as possible. And so you don't need skilled nursing facilities. You just need an adult to be able to accompany you and be with you at least for the first 24 hours after surgery. Jessica A, can you do lipo above the belly button and below the belly button? Yes. So that would be liposuction of your abdomen. So we can definitely do liposuction of your abdomen. Absolutely. Contact us and we'll be happy to guide you through the process. 281-724-3138. What is the recovery time? Loving me and loving it. The recovery time is fairly quick for my patients. They usually are walking upright within 3 to 5 days. They're off their pain meds as well during that time. They come to see me usually a week after surgery. And at that point, they're released to go back to the treadmill in the gym. They typically will be back at work, desk job, and then no heavy lifting, no strenuous activities. And then by the time they get to 2 to 3 weeks, they're on the treadmill, walking a lot at a brisk pace. And by 6 weeks, they're in the gym doing light resistance training and build it up by then. So fairly quick recovery time with the drainless technique that I do. Chiffon Williams, 275. What is the cost for the drainless tummy tuck? Drainless tummy tuck usually is around $13,000 to $15,000, and that includes all of your pre and post-op care, your anesthesia facility and surgeon's fees, your garments, as well as your specialized scar cream. So contact us. We will be happy to take care of you. I love doing the drainless tummy tuck. It is a game changer for my patients, makes them recover so much easier, so much faster. A lot of patients have come in, especially because they've been wanting to have a tummy tuck done, but they just did not want to have the drains. I've heard some horror stories about them and just don't want to be dealing with it. And the drainless tummy tuck is a phenomenal way to actually bypass all of that drama and minimize the risk of seroma and infection and complications. And my patients are extremely pleased and thrilled. Fab and Fit Becca. Is the tummy tuck where they remove the loose skin? Yes, it is. So the tummy tuck is where I remove essentially all of this extra skin. Her belly button is right here. So I cut all of this out. All of that big chunk is gone. I fixed the sagging fatty upper pelvic area, so the fupa area, and make it much, much straighter. As you can see here, much, much straighter. It's not, I guess I have to change fingers. It's not bulging out like that anymore. It's nice and flat. So huge difference for my patients. They're extremely, extremely pleased. The other question that I typically will get as well is, am I too old for this procedure? So people will say I'm 45 years old, or you're very welcome, JMJ. I'm glad you found some value in this. I'm 52. Am I too old for this? No. Age is not really the limiting factor. What I look at is your overall health. I've operated on patients in their 20s, 30s, 40s, 50s, 60s, and even in their 70s, and they have done extremely well. So it all depends on how healthy you are. We have to make sure that there are no medical conditions that would limit you from moving forward with those procedures, and we will be happy to help guide you through that as well. Christo is asking, do you have before and after pics of facelift procedures? I used to when I worked with my other practice, but since I left them, I wasn't able to keep those pictures. So I'm definitely working on developing some new ones now that I am in solo practice. I have some pictures of facial surgery that I've done on men, and also some facial rejuvenation procedures with quad lifts, so upper left, lower left, fat transfer. I've done some neck lifts on men, and I'm working on developing some before and after pics of facelifts as well. I've really enjoyed doing the facelifts. They're a very transformative procedure. Liz Sparkle, what's the best BMI for a tummy tuck? Best BMI is for you to be around 5 to 10 pounds from your ideal weight. So I would like for you to be anywhere close to like a BMI of 45, of 25. Sorry, 45 is way off the charts. 25. Anywhere between 25 to 30 will be fine. Anything above that 30 mark, so 32, 34, 35, that's kind of like, much, much higher. 35 is my cutoff. Very good questions, everybody. I appreciate that. Lindsay Reagan is, I'm in Texas. Wonderful. We'll be happy to take care of you. We're in Houston, H-Town. So come and see us. If I know Texas is huge, so you can be driving for 10 hours, you'll still be in Texas. So if you're pretty far away from Houston, definitely we will start with a virtual consultation with you. You'll fill out your medical history, send us some pictures, and we'll get the ball rolling. Text us or call us, leave a message. You can text us 24/7. We'll make sure to respond to you within the first 2 business days after. And if you don't hear back from us, by all means, please go ahead and text us again, call us. It could be that we never received the text or something happened, but we are always happy to accommodate you, answer your questions, guide you through the process, and operate on you, and help you guys live your best lives. Joe Stein, I'm on Wegovy. Now, before I have any procedures such as tummy tuck and lipo, when should I stop the Wegovy? So I usually will have my patients stop any kind of medications like that, GLP-1 medications, 3 to 4 weeks before surgery. At the latest, I would want you to stop 3 weeks before. Otherwise, 4 weeks is fine. That way, it will allow your stomach to empty out completely, so we can decrease the risk of you having any type of risk of aspiration and problems and issues. Renee Warren 525. How much is Lipo 360? For pricing, please go ahead and text us. We will be happy to give you some estimates. I don't have those prices with me. My patient coordinator does. So call us, contact us, text us, and let us know when's the best time to reach out. We will call you and get a hold of you and get you on the books for your consultations and for your surgery. Andy, what's the surgery to get your back rolls removed? That is what I call a broad line lift. So that's kind of like the layman's term. The technical term is called a torsoplasty. So we can do it in women, we can do it in men as well. Those rolls that are really bothering you and kind of sagging in the mid upper back, we fix that by lifting that tissue to make it nice and tight, and then we just cut out that excess tissue on the back. So contact us. We will be happy to take care of you. I really enjoy doing these types of procedures for my patients. It's a huge difference for them. Jody, what if you smoke? If you smoke, I want you also to stop 4 weeks before surgery, especially for these big procedures, and then don't start smoking until 4 weeks after. If you can, just use that opportunity to quit. It's much better to go ahead and just quit it. Marjev, I had lipo and I feel I didn't get what I wanted. How do I know it would work again? You have to come in for us to see you. Schedule a consultation. I'll be able to examine you, see what tissues you have when where, and explain to me kind of like what your goals are, and I'll be able to let you know what procedures would work or if it wouldn't work at all. That's how we would do it. So you have to come in for a consultation so we can see you and examine you, and then we can delve into all of the possible treatments that you might benefit from. Rebel with a cause. What is typical turnaround to heal? For these procedures, the drainless tummy tuck is fairly quick. My patients typically will be walking upright within 3 to 5 days, not hunched over for like 2 or 3 weeks like you do when you have drains. For this one, you're going to be walking upright immediately. You'll be off those pain meds usually around that same time frame, 3 to 5 days. You're off your pain meds. You come see me within a week after surgery. Most patients are driving themselves back in. They're walking upright. They're off their pain meds, and they're back at work. Desk job. At that point, you're going to start increasing your aerobic activity. So walking on the treadmill, 2 to 3 weeks, you're back in the gym doing some treadmill workouts. And then by the time you get to 6 weeks, you're doing some light resistance training. So it's a fairly quick recovery with the drainage technique that I use. Jody, do you do them on people who smoke? If not, how long do you have? Yes, so we answered that question, my dear. I said I would want you to quit smoking 4 weeks before surgery. I would do procedures on people who smoke, but they have to quit 4 weeks before surgery. No nicotine products, so no vaping, no chewing, no smoking, none of that, because it puts you at high risk of actually having some serious wound healing problems. And we don't want to go through that. These are elective procedures, meaning that they're not mandatory, they're not urgent or emergent or necessary. These are procedures that you choose to have done. So we want to make sure that we optimize everything to give you a nice, smooth, happy experience. Naim and TLVO. Sorry, I'm not sure what New York Lean. And anyways, what's the price for tummy tuck? For the drainless tummy tuck, it ranges around $13,000 to $15,000, and that includes all of the cost of surgical facilities, anesthesia fees, and surgeon's fees, as well as all your post-op appointments, your garments, and your scar cream. Liz Sparkle is asking, why don't some doctors recommend doing a mommy makeover with multiple procedures? I'm not sure. Maybe they're not comfortable doing multiple procedures. There are some doctors that are not comfortable combining procedures, and they prefer to separate every single procedure. We do mommy makeovers. I do mommy makeovers all the time with multiple procedures. I've done up to 6, 7, 8 procedures on a patient in a mommy makeover. Of course, I can't do it in every patient. It depends on this particular patient. But for a mommy makeover, on average, it's going to be probably anywhere between 4 or 6 procedures that we can include safely. So you want to combine your procedures for your mommy makeover, by all means, come and see us. Text us 281-724-3138. We will be happy to take care of you. What is the ideal weight for a tummy tuck? Is Amanda's question. Great question. It's not necessarily the weight. Weight-wise, I would say you want to be between 5 to 10 pounds from your ideal weight. But it's based on your BMI. So a normal BMI would be around 22 to 24.9. That would be a normal BMI. An overweight BMI will be 25 to about 29.9. And then obese is 30 to 34. And anything above that is much, much, much bigger. So to do the tummy tuck and be able to have good results and keep them long term, I would like for your BMI to be around 28 to 32, in that range. I've operated on patients that have higher BMIs as well. My cutoff is 35. Cost, please. All right. Contact us for any cost. Does it come with muscle repair? Yes. Toxic traits, it does. So all of my drainless tummy tucks come with the muscle repair. I also fix the fupa area, so it's called a monsplasty. I give you a nice belly button and then remove all of that excess skin and fat that's bothering you. So that is part of the package, absolutely. And I always inject Exparel medication for all my patients to give them a much smoother recovery and decrease the amount of pain medication that they need. For the great majority of my patients, it makes a huge difference. Everybody heals differently and has a different pain tolerance. So sometimes we need to adjust the pain medication, the pills that you get. Everybody's different. So I always call my patients the night after surgery to make sure that they're doing well. We discuss their pain level, and then we adjust pain medications as needed on a case-by-case basis. Coach Bianca, I'm 28 days post-op from a drainless tummy tuck, and the incision is opening back up. So my recommendation would be definitely go see your surgeon who operated on you. You want to discuss that with them and make sure that they take care of you appropriately. They should be able to provide you with appropriate post-operative care. 28 days is still well within the time frame for them to actually take care of you. So absolutely contact them, follow up with them, and have them give you their best recommendations. Anthony, have you ever hit a nerve like the ilioinguinal and genitofemoral? Yes, that can happen. If you do liposuction of those areas, you can irritate those nerves. Usually it'll take some time, and you will typically you'll typically recover from that. Any kind of inflammation or irritation that you have will be temporary. Jackie009, I'm diabetic. Is it possible? It is possible. I've operated on patients who have type 2 diabetes they have done extremely well. We have to make sure that your blood sugar is well controlled. And to do that, we need to make sure that you have your hemoglobin A1C is 7 or less before we move forward with surgery. So I've had some diabetics come and see me. They've been wanting to move forward with all types of procedures. Some would want, lipo 360, BBLs. Others would want drainless tummy tuck. Others would want, hey, tropical exotic treats. Nice to see you again. Some want a mommy makeover. Regardless of the procedure, we always have to make sure that your blood sugar is well controlled. So I've had some patients come in, their blood sugars were 12, 14, the hemoglobin A1C. Thank you for the roses. 12, 14, 15, way too high. We need to bring it down to 7 or less, and then we can move forward with surgery. So, excellent. Go popular. I love it. All right, let's see. So again, for anybody who's asking about cost, by all means, come and see us or contact us, 281-724-3138. Call us, leave a message, text us 24/7. We will respond to you as soon as we can and get in touch with you so that we can discuss it further, give you some estimates of what you can expect your budget to be. And then when you come in person or have your consultation virtually, we'll be able to give you an exact quote. A crazy mama 4 and a pig. I'm always bloated. Will I still be able to get a tummy tuck? You should be able to get a tummy tuck, but you being bloated, I would say definitely go and start with your PCP, but you might need a referral to a gastroenterologist to see what is the cause of that bloating. But it shouldn't deter you or be a contraindication for you to get a tummy tuck. And so contact us. We'll be happy to take care of you and get you back in a nice looking body after having 4 kids. Congrats to you. And a pig. All right, let's see. Can you get this if you have diastasis recti? Yes, Melly Mac, absolutely. So the diastasis recti is separation of your ab muscles. I fix the separation of ab muscles with all of my patients who get these procedures. So the drainless tummy tuck is the procedure that I do to also fix and address the separation of your ab muscles. So that's what allows me to fix your diastasis recti. So definitely come and see us, and we will be happy to take care of you. Okay, so we've got a question, a Hail Mary here. Miss Crazy Cool, how can I get my insurance to cover this? Your insurance is not going to cover tummy tuck. I would be extremely surprised if they do, because it is considered by the majority of insurance companies as an elective procedure. So whenever it's elective, you pay out of pocket. All of my patients pay out of pocket. Regardless, my office does not accept insurance. I've had some patients who've had parts of the tummy tuck be covered by insurance, and so they'll negotiate to be able to get reimbursed directly by the insurance, but they will still pay our office out of pocket. I want a tummy tuck. Okay, Sash in charge. We'll be happy to take care of you. Come and see it. Come and see us, and we'll be happy to give you a. Me too, Ruan Tomlin. You also want a tummy tuck? By all means, come and see us. Please take advantage of these low prices that we have for the rest of the year. We're running this special for our drainless tummy tuck. Like I said, the range is in between $13,000 and $15,000. It will be going up next year. And I've had a very interesting question as well. People were asking if the drainless tummy tuck is more expensive than the typical tummy tuck. And my answer right now is it depends on, I guess, your surgeons. But my drainless tummy tuck is actually much cheaper, much less expensive than the traditional tummy tucks that people are getting. I've had some people who have contacted me who come in, and want other things like breast done and stuff, and they'll tell me what they paid for their tummy tuck, which had drains. So they didn't even benefit from the special technique that I use. They paid anywhere from $18,000 to $20,000 to even $22,000 for a traditional tummy tuck. So a drainless tummy tuck technique at $13,000, please by all means, that is a steal. Take advantage of it. We're going to keep that price for the rest of the year. By next year, it's going to go up. So absolutely book now and enjoy this huge discount on this wonderful procedure that we do. Not all plastic surgeons do. Actually, a very small percentage of us in the US do the drainage technique. So definitely come in. We'll be happy to take care of you and give you some wonderful results. Big Mir, what is the price of your consultation? $150 for you to book your appointment with us, and that will go towards your surgery when you book your surgery. Brown Babe, how do people fly in pain after procedures on their abdomen? So after these, so we get patients that come in from all over the U.S. and even from outside the U.S. to have their surgeries. They'll typically stay in the Houston area for about a week and then be able to fly back. From the drainless tummy tuck, all of them do extremely well, have no issues. We just need to make sure I need to make sure I adjust your number of days for your blood thinners, because I want to minimize any risk of you getting a blood clot from the flights and sitting down and things like that. But we adjust that based on each patient. So as far as like pain wise, you're great. By the time you come to see me, usually a week after surgery, most patients are off their pain meds, standing upright, and are able to drive themselves and are completely more or less, very, very functional and are able to go back to work. So being able to fly after the drainless tummy tuck a week after is not an issue. Okay, Poetic Justice, I think I answered that question. How much is the procedure? Average $13,000 to $15,000, like I was saying. Take advantage of those discounts right now before the price goes up January 1st, 2026. Regina Jones, I need you for everything. Arm lift, tummy tuck, and liposuction. I will make an appointment. Absolutely. We'll be happy to take care of you. We've operated on many, many patients who've wanted full body transformations. Typically, we'll take 2 stages, sometimes 3 stages, depending on all the procedures that need to be done. We try to book surgeries that go around 6, max 7 hours, and that's a lot of surgery. So a full body transformation sometimes needs to be broken down into 3 stages. Otherwise, it's just asking way too much for your body to heal. A 10-hour procedure is just way too long. So 6, 7 hours is good enough. Your body is able to recover from that. You come back and do another 6, 7 hour procedure. It's a lot of surgery, and we'll be happy to take care of you. And Dimanche, how much is the tummy tuck? Tummy tuck is $13,000 to $15,000 on average, and it's a drainless technique which allows you to have a much easier and faster recovery. Thank you very much, Jackie Marie, for answering the questions. I appreciate that. Jackie Marie is one of my wonderful patients. She's gone through the procedure, has beautiful results. She did extremely well, barely took any pain medication, and was able to travel back long distance the day after surgery. Okay, Stash and Charge. What is the difference between the drainless tummy tuck and the other tummy tucks? So my tummy tuck technique allows you to heal much faster. The traditional technique that pretty much every plastic surgeon learns in training is to put drains in. So all of the space where we operate is open. Your skin and fat are lifted up from the muscle area. We fix the separation of muscles. We pull the skin, cut the extra out, right? And then we will put stitches around the bottom part and then around the belly button. So all of this is actually open space where you put drains in and the fluid collects. And it takes about 2 to 3 weeks for that fluid to go out. With my technique, I actually close that space meticulously with stitches. It closes that space so it minimizes any risk of fluid to collect, and there's no need to put drains in. That allows you to actually heal much faster and recover much faster. So for those of you who want to go back to work a lot faster, a lot easier, want a much smoother recovery, drainless technique is the way to go. Can we get this paid by the insurance company? No, I highly doubt it. We don't take insurance. My office does not take insurance. All our patients pay out of pocket. Now, you may have your specific insurance company may have some benefits where they will reimburse you for part of the tummy tuck. So, like the paniculectomy part, definitely contact them and discuss what your benefits are and see if you will be able to get some reimbursement if you were to proceed with these procedures. Yeah. But our office does not take insurance. All of our patients pay out of pocket. Can I pay with out of state FSA? I'm not sure. As long as your state laws allow for you to pay for these elective procedures through that, if it goes through, we'll be happy to take it. But otherwise, I'm not sure. Is Exparel included? Absolutely. Teresa McCassell, I always inject Exparel for my patients when I do the muscle repair. It makes your recovery much easier, decreases the amount of pain pills that you need, and overall makes it for a much smoother recovery. Okay, so let's see. Poetic Justice is saying, I need a real tummy tuck because my abs needs tightening. Can you do that as well? Absolutely. That's what I do. So the drainless tummy tuck here includes the, you can see the huge difference. Huge difference. Part of that is because I also do the repair of the separation of muscles, which really tightens everything up to give her a nice flat belly. So I do essentially 4 procedures, you can say. The muscle repair, I cut off the excess skin and fat. I do the monsplasty, so I fix the fupa area as well, and I give you a nice belly button. So those are all included in the drainless tummy tuck technique that I provide for all of my patients. So contact us, 281-724-3138. That is our phone number, and we will be happy to get the ball rolling, get you in for your consultation, and get you on the books for your surgery. So definitely take advantage of the prices right now. They are at an all-time low. Average is $13,000 to $15,000 for the drainless tummy tuck. You can add other procedures as well and get a full mommy makeover. But definitely take advantage of these prices for the rest of the year, up until December 31st, 2025. Harris to heaven. Diastasis recti and C-section from 2 separate pregnancies. Is tummy tuck good option? Yes, absolutely. I've operated on patients who had 5 C-sections before, and they've had hysterectomies on top of that. They've had vertical C-sections and horizontal C-sections on top of all of that. So absolutely. And I've given them beautiful, beautiful results, keeping the scar nice and low in the bikini line so that it pretty much looks like you've never even had any of those other surgeries. So come and see us. We will be happy to take care of you. Contact us. Easiest way is text us or call us, leave a message, text us anytime, 24/7. We will respond as soon as possible. Licia is asking, do you do people with a high BMI? Max BMI is 35. If your BMI is less than that, you're good to go. Thank you very much, Dr. Maria. I appreciate you answering all the questions. Yeah, very good. Yes, they won't regret it. I'm telling you, Jackie Marie's been following us for well over 2 years now. Came through TikTok and has had a phenomenal recovery, has beautiful results. So much so that she even wants to get some more procedures done. So we're always happy to have repeat patients, customers come in. We're happy to take care of you. And she's thrilled with her results. So we're very, very happy to have you guys come in. Your BMI is 50. No, you will not be a candidate for these procedures. You would have to lose weight. Either you can start with these GLP-1 medications or get some type of bariatric surgery to lose that weight. K-MoMA, do you do lipo? Absolutely. We do liposuction, lipo 360. We do liposuction of the thighs, the arms, multiple areas of the body. And then you can use that fat to transfer it elsewhere. So Sonia Henny, again, if your BMI is 50, you will not qualify for this procedure. For any of these procedures, your BMI is way too high, way too risky for these big types of procedures. Like I said, start with GLP-1 medications, semaglutide, Wegovy, Ozempic, whatever you can to really drop that weight and get to a BMI of 35 or under, and then we can move forward with the surgery or get bariatric surgery. Or a combination. I mean, you can diet, exercise, drop the weight. There are some patients who've lost 150 pounds, 200 pounds by just being very dedicated and exercising religiously and dieting strictly. So it can be done, but there are options there for you as well. Okay. Yes, this is surgery. Drainless tummy tuck is surgery. No non-surgical, non-invasive procedure will ever give you these results. Drainless tummy tuck is this gold standard. Everybody else who's out there promising you cool sculpting and things like that, it will never give you these beautiful results. They're always trying to mimic surgery results and get you as close as possible, but they can never achieve it. So this is definitely surgery before and after. It's about a 2 or 3 hour procedure. It's a same day surgery, so you leave the facility the same day. You don't have to stay overnight. You don't need specialized care. With the techniques that I do, you're able to recover fairly quickly and be on your merry way. Ms. Thick 706, is it recommended that I lose weight? I'm naturally small in the waist, but my stomach is big. So we want you to lose weight if your BMI is 35 or above. If you're less than the 35 BMI, you will qualify for these procedures for us to do your surgery. But if you have a lot of visceral fat, so fat that is actually around your organs inside your belly, not subcutaneous fat like below the skin, actually inside your body, you have to lose weight. That's the only way that you'll be able to decrease that bulging of your belly and give you much nicer results. Okay, I'm tall, but the BMI is high. Just want to get rid of the fupa. Come and see us. There are some procedures that we can do. So if you just want to target the fupa area, there are some procedures we can do. It's called a monsplasty. And come and see us. There are some things that we can do. We'll have to see, what your health is, overall health, and then discuss that. I'll examine you and see what can be done. So a lady to love, 281-724-3138. Shoot us a text, call us, leave a message, and we'll get back to you, okay? BMI is 32. Wonderful, 5'6". Okay, excellent. You will, based on that, you would qualify for my BMI cutoff to come in for your procedures. We have to make sure that you don't have any other medical problems that would be a contraindication, but barring any of that, you're good to go. So shoot us a text and come in and see us, and we'll get you on the books for your surgery. Let's get that body transformation going. Sonia Haney, I have a problem losing weight. I have a thyroid problem. Okay, so definitely make sure that you go see an endocrinologist to diagnose what type of thyroid problem you have, and they will put you on medication to make sure that that is taken care of, and so that will help you lose weight. But any medical conditions that you might have, they all need to be appropriately managed before we can move forward with surgery. But I've operated on patients who have hypothyroidism, who have issues with their thyroids, who have problems with other organs. So they have like high blood pressure, or they may have anemia or autoimmune diseases. I've operated on them as long as we optimize their condition for surgery. Busy B22, you can Medicare pay for plastic BBL under certain standards ration. No, Medicare will not pay for any of these procedures. These are all considered elective aesthetic procedures. They will not cover any of this. This is all out of pocket. It's an elective procedure. You have to pay out of pocket. And we offer financing options as well for patients who want to take advantage of those opportunities to be able to get on the payment plan. So contact us, and we will be happy to guide you through that procedure, through that process. And Maria, how much total for the drainage tummy tuck? Ranges $13,000 to $15,000, $13,000 to $15,000, and that's definitely the lowest. Definitely take advantage of those prices, because come January 2026, we are going to increase those prices. You're definitely getting a huge value right now for this drainage tummy tuck pricing that we have set up. Your recovery is much faster, much smoother than the traditional tummy tuck where you have drains in. And from what I've heard, a lot of patients pay much more than what we charge right now for the drainage technique. So we're going to be doing some adjustment of our pricing starting next year. So definitely take advantage of it now in 2025 while you can. Yes, I can't wait to get my mommy makeover. All right, JMJ, we'll be happy to take care of you. Absolutely. Come on in, everybody. Great questions here. 22 sweet pea. Is it with lipo? No, this is cutting out the skin and fat. And fixing the muscles and fixing the fupa area. If you want to add liposuction, absolutely we can do that. But that's on a case-by-case basis. Not everybody needs liposuction. So definitely if you feel like you have excess stubborn fat in your love handles, in your back, in your bra line, we can definitely enhance those curves with liposuction. Cheryl 24, do you have a long payment plan? We do. I believe we have 2-year payment plans as well through the financing option. So definitely contact us, and we'll be happy to get that going for you. Yvette, what is the difference between the drainage tummy tuck versus the traditional one? Great question. I think it's probably the third time I answer it tonight. The traditional one, you have drains placed in, and all of the space where we operate is actually open. So it takes about 2 to 3 weeks for that fluid to go away and for your tissues to start to get together and to start to heal. When I do my technique, I actually don't place drains. I put stitches, meticulously stitching technique all the way around that whole area so that your tissues immediately start to heal from the moment we're done with surgery. Everything is already attached and it starts to heal. It minimizes your swelling, improves your recovery, and decreases your risk of other complications. So that's a huge difference in the techniques. And not that many surgeons do the drainage tummy tuck that I perform. So come and see us if you're wanting to have a much, much better experience and recovery, and we'll be happy to take care of you. Louise Campbell, do you need a visa to come? You mean to come to, if you're out of the US, I mean, you'll be bound by whatever travel regulations are. So if you're not a US citizen and your country requires you to have a visa to come to the US, then yes, you will need a visa. Otherwise, no. I mean, if you're in the US, there's no need for a visa. So it all depends, I guess, on which country you're coming from. You'd have to look at your travel recommendations there. Hey, Tropical Exotic Treats, nice to see you. Looking forward to taking care of you. I believe July it is, next month. All right. Okay, Sonia Haney is saying, I've had a problem. My BMI is over 40. Can I get the procedure? No, you will not qualify for the tummy tuck with the BMI over 40. We have to make sure that your thyroid problem is under control. So again, see your endocrinologist and make sure that they really get that under control so you can start losing that weight. Get that weight down to your BMI of 35, and then we'll be able to go ahead and proceed with the drainage tummy tuck for you. Yeah. So there's a couple more steps that you need to go through for safety reasons, and for you to be able to get that taken care of safely. Busy Bee 22. Do plastic surgeons work on okay free in certain situations? On patients, probably free? No, we do not. It is against the law for us to provide free surgery or services. So we are not allowed to do that. Okay, so I think I already answered that question about the thyroid. But I mean, for you guys who are wanting to have free surgery, by all means, I mean, you can start. You can start. Your fundraising campaign. Have friends, family who love you, who are supporting you, and just have them contribute and get your fund raiser going, and come up with the money. It's $13,000 to $15,000 for the drainless tummy tuck if you want to have surgery with us at our office. So definitely get that going and see who can help you raise those funds. Vicky Aisu, tummy tuck, arm lipo, and facelift. Can this be done at the same time, the same day? No, I wouldn't do all of that at the same time. You could probably do the tummy tuck, lipo, and arm in one surgery, and then do the facelift in another surgery. That would be way too much surgery to do in one go. Lap ugliest. Why is it always the ones? What do you mean? Do you mean the before and afters? Oh, I take all patients, all skin tones, all patients from all backgrounds. Coco long number. What lab tests will disqualify you from surgery? So if you have a positive nicotine test, will disqualify you from surgery. If your hemoglobin is too low, so you're anemic, that would disqualify you from surgery. Anything that will have your labs be out of whack, electrolytes, CBCs, you will not be able to go forward with surgery. We have to make sure that we fix all of that before you get surgery. P. Lewis 69. I had a paniculectomy that looks horrible. Am I a candidate for this procedure? I can't answer that question. I have not seen you. You have to come in for a consultation so I can examine you. I need a lot more information to see whether or not you're a candidate for that, what your BMI is, what your health issues are, what your scars look like. Definitely come in for a consultation. We can get into the details a lot more so that we can guide you appropriately. Okay? Book your consultation. It's $150 for you to book your appointment. Come in and see us. We will be happy to discuss this in greater detail, get you on the right path for you to be able to get these procedures. Sparkle is asking, what is the price? I think a lot of people are asking about the price. For the drainless tummy tuck, it's on average $13,000 to $15,000, and that includes all your surgery fees, so your anesthesia fee, facility fee, surgeon's fees, your post-op and pre-op appointments, your garments, your aftercare, as well as your scar cream. All right, Vicky, would you do a tummy tuck on a lupus patient? I have already performed tummy tucks on lupus patients, yes, and they have done extremely well. You can scroll through some of the pictures that I've posted on my social media, on TikTok and Instagram, and also on my webpage. Some of those patients have lupus. Of course, I can't tell you who they are because it would be a HIPAA violation, but they have multiple medical conditions. All of my patients, but they've done extremely well, as you can see. So if you have lupus, as long as it is under control, so we'll be coordinating with your rheumatologist or whoever is taking care of your lupus, and make sure that it is well controlled before we move forward with surgery. But definitely, we'll be happy to take care of that for you. Yes. Jackie Marie says, I'm so happy I got mine. Excellent. Yes. So you guys, if you want to have these surgeries done, come and see us. We'll be happy to take care of you. Oh, Lady J, which would be the safest procedure for me after having a heart attack a few years ago? That is a hard question to answer. It depends on what you want to have done. It depends on what your state of your heart condition is right now. So you'd have to undergo some workup with your cardiologist to make sure that there's no issues. If there are issues, then it will determine what procedures you can or cannot get. Red dot. Can you do liposuction? Yes, I do liposuction. Liposuction is part of the procedures that I perform on my patients. I do, like I said early on in the live session, I'm a board certified plastic surgeon and I practice in Houston, Texas. I do body contouring. So that includes liposuction, fat transfer, breast lift, breast augmentation, fat transfer to the breast, so breast augmentations with implants or fat. I do breast reductions, tummy tucks. I do the drainless technique. I do mini tummy tucks. I do the fleur-de-lis technique. I do body contouring after weight loss surgery, body lift, which includes the drainless tummy tuck, the monsplasty, hip lift, butt lift, thigh lift, arm lift, you name it. We do all of that to really get your body contoured, to increase your overall health status as far as like hygiene is concerned, your quality of life, so your mental health, your well-being, all of that is well improved. Tina is asking, what's your starting price for a mommy makeover? Usually, a mommy makeover would be anywhere between 18 to $20,000 on average is the starting cost. And then it can go up to $35,000 depending on all the procedures you have done. Earlier in the live, I was saying that I've operated on patients and done up to about 7 or 8 procedures at once, which is a lot. But if it can be done within that 6 to 7 hour time frame, we can do that and we are able to actually transform a lot of the body. That will put you more on the $35,000 range as far as your quote is. But everybody is different in terms of what procedures they want to have done and how we're going to stage that. So definitely contact us, Tina, 281-724-3138. Call us, leave a message if it's after hours, or text us 24/7, and we will be happy to reach out to you and get back to you. So leave us your name and what procedures you're interested in having. Tori, how many hours is the tummy tuck? So the drainless tummy tuck on average is about 2 to 3 hours, and it's a same day procedure. So all of my patients will leave the facility the same day. Be jolly. I had a tummy tuck last month. So much time, so much pain. I'm sorry you had that experience. It wasn't me. I wasn't your surgeon, but I'm not sure what procedure, what techniques they used, and if they injected Exparel or not. So it all depends on the surgeon. It depends on the techniques. Everybody heals differently, of course, but on average, my patients do extremely well with very, very little pain. Maybe the first day or two max. Like I said, usually by day 3, 4, they're off their pain meds. And if any, they may take some Tylenol. But sorry you had that painful experience, but that is not typical of my patients. Is there an age limit for a tummy tuck? Just me? No, there is not. I've operated on patients in their 50s, 60s, and 70s, and they have done extremely well. As long as you're healthy enough to undergo these procedures, we can move forward with them. Just recently, the most recent patient I did a full body lift, which is the drainless tummy tuck, the monsplasty hip lift, and butt lift. So her scar goes all the way around, a 360 scar. I posted her results on a TikTok video. I think she was at 3 weeks, very early on. She looks fantastic. I just saw her today at 6 weeks, and I'm going to post her next 6-week results. Amazing. In her 60s, doing extremely well. So there's no age limit. As long as you're healthy enough, we can go ahead and move forward with these procedures. Steve, hi. What is the difference between Lipo 360 and a tummy tuck? So Lipo 360 is liposuction, which is sucking out fat. That's different than, and 360 means you're kind of doing all around the torso area. So the belly area, love handles, back, and bra line. That's just 360, talking about 360 degrees. The tummy tuck is the actual cutting out of excess fat and skin. So with the tummy tuck, patients will have a scar that goes from hip to hip. Liposuction, you have really, really tiny poke holes where you actually insert the cannula and remove that fat. So that's the difference. So the liposuction will remove fat, so areas of stubborn fat. It doesn't treat loose skin. It doesn't fix the separation of muscles in your belly. So they're different procedures that treat different things. Esma is asking how much. So how much? Definitely contact us, 281-724-3138. Shoot us a text, call us, leave a message. For the tummy tuck, it's around 13. Oh, sorry, I already answered this question. Why is TikTok bringing these questions back up? $13,000 and $15,000. $13,000 and $15,000 for the tummy tuck. Junebug, do you accept insurance? No, our office does not take insurance. All of our patients pay out of pocket. These procedures are considered elective aesthetic procedures. They're not covered by insurance. But we do offer financing options. Patient Fi, Care Credit, Alpheon, and Cherry Financing. The Perfectly Imperfect Me. Do you do plus size skin removal and tucks? Yes, BMI max is 35. Those are my plus size patients. Look at some of the videos that I posted. I think it was probably within the past 3 to 4 weeks. I have a patient whose BMI is around 35.8, almost 36. You can really tell that is a plus size patient. Even other comments were like, isn't she too big to be able to do these procedures? She did very well. So I do perform these big procedures on plus size patients, but the cutoff BMI is 35. Sonia Haney, I guess that is a no. No, if your BMI is over 40 and you have thyroid issues, you have to fix that. There's a lot of stuff that needs to be done to get you to be optimized before we can move forward with surgery. At this time, with you having thyroid issues and a BMI 40, you're not a candidate for surgery. It doesn't mean that we can't get you there. Like I said, I have some patients who've come in and they want a tummy tuck, but their hemoglobin A1C is 15. That's their blood sugar. They're diabetic. They're not a candidate for surgery, but we get them ready. And usually it takes them probably a period of 3 to 6 months to get that sugar down. They get that hemoglobin A1C to 7 or less. Now they become a candidate for us to proceed with surgery. Same with patients. I've had some patients who come in, they're anemic. They're not a candidate for surgery. But once we get their hemoglobin to a safe level, then they become a candidate for surgery, and we can move forward with the surgery. Same for you. I've had patients who've come in who have thyroid problems. We make sure that they get their thyroid problems taken care of. BMI goes down, and then they become a candidate for surgery. Yeah. So it's not like, there's no option for you. Absolutely there is. It's just that right now in this time, like if you do a cross-sectional cut, right now you are not a candidate for surgery, but you can get to where you will be a candidate for surgery. Absolutely. Can you get lipo with the drainless tummy tuck? Absolutely. Tony Varisco, I have done that on many patients of mine who are very interested in getting liposuction with their tummy tuck. Thank you guys for joining us. If you have any questions, please go ahead and enter them in the chat. I'll be happy to answer them. Otherwise, enjoy the live session. So yes, liposuction with the drainless tummy tuck, absolutely. I do that for my patients. Hey, LaWanda Wilson, how are you doing? Nice to see you. Thank you for joining us. I appreciate it. Jackie Marie is also taking care of answering questions here. Always nice to have my patients come in after they have undergone their procedures and are happy with the results. Miss J385, how much does the procedure cost? $13,000 to $15,000 on average is what the drainless tummy tuck costs. But you're welcome to add other procedures. Some people will have liposuction added to that. They will have fat transfer added to it. They will get their breasts done as well. So that is kind of like the building block. All right, guys, we are well beyond an hour of Q&A sessions here. I am going to wrap it up. And let's see, I have okay, probably yes. Yeah, so again, your question is coming back up, Sonia Haney. Can I still get help? Absolutely. Like I said, you need to get sure you get plugged in with your endocrinologist. They can help with your thyroid problem, and that will get fixed. Then you can start losing the weight, and then you can come and see us, and we'll be able to remove that excess skin and fat that's bothering you and taking care of you. Absolutely. Okay, so TikTok keeps bumping all these questions back to way up high. You're very welcome, Sonia Haney. I'm very happy I could answer your questions. And like I said, definitely we just need to make sure that you get plugged in with the right physicians that can get you to that point where you become a candidate for me now to step in and take care of you safely. We want you to be healthy to be able to undergo these procedures safely. Okay, thank you for answering that question, Luana Wilson. I appreciate it. I have a fantastic belly button that he did. You can't even tell it's new. Wonderful, excellent. Christy Yamaguchi. I texted the number, but no reply. Okay, put in your information in the form here on TikTok, and let us know what procedures you're wanting to have done, and we should be able to get back to you. But I'm surprised. Text it again, even tonight. Text it again, 281-724-313. And I think that's the correct number. That's the number I've been giving for the past couple of months. So, and I think we've been getting texts from there. But just please text us again, okay? How do you figure out your BMI? Go to Google, type in BMI calculator. You were putting your height. So usually the link that I go to is the NIH Institute's website. Click on it and you'll see and put in your height, your weight, and you'll see what your BMI is. If it's higher than 35, play around with the weight and you'll see what weight you need to be at to get your BMI of 35 or lower. And that will help guide you as to how much weight you need to lose. Yeah. Hello, Isala. Hello, Dr. D. Hope you have a great day. Thank you so much. You too as well. I know you're traveling. You're out of the Houston area. Have safe travels, and I look forward to having you come in for your follow-ups. Okay, great question. Marissa Fonseca is saying, I have severe separation of my abdomen, kids. Can I ever close it with the gym only? You cannot. No matter how many crunches you do, it's great to do that because it's going to get your body in shape. It's going to develop your core, but unfortunately it's not going to fix that separation of muscle. That tissue between the muscles has been stretched. It can't just spring back in, unfortunately. And so if it's that stretched and you have a severe bulging, we have to fix it. So the gym alone won't fix it. It will help to definitely work your core, get you healthy to where you'll bounce back very quickly after the surgery. But come and see us. We'll be happy to take care of you. Okay, so accurate results. My BMI is 30.9. The picture displayed, did she get lipo 360? No, this patient did not get any liposuction. She only got the drainless tummy tuck procedure. No liposuction at all. This is me cutting out the excess skin, cutting out the excess fat, fixing her mons pubis area, fixing the separation of muscles, and giving her a new belly button. And that makes it really nice for her results. Contact us, 281-724-3138, and we will be happy to guide you through the process and get you guys in for your procedures, okay? I wouldn't do a facelift at the same time as getting the tummy tuck. It would be too much of a procedure for you to recover from. Some surgeons would do it, but not that many surgeons are able to squeeze in that in a safe amount of time. Okay, wonderful. I really appreciate you guys participating tonight. Um, and I wish you all a wonderful night. Remember, I do these Q&A sessions every Tuesday and Thursday, starting around 7 p.m. Central Standard Time, so Houston time. Contact us, 281-724-3138. Call, leave a message, text us, or follow us on TikTok, DM us your information, and we will reach out to you. There's plenty of ways for you guys to reach out to us. We're always happy to get you guys in for your consultations and on the books for surgery. Go to my website. There's a book now button. There's text me. There's forms you can fill out. There's many ways for you guys to reach out and see us. Okay. Really enjoy taking care of you guys, and thank you very much for participating. If I didn't get your question tonight, I apologize. Please go and just reach out to us anytime during the week. Put a comment on any of the posts on TikTok. I will respond to it, and we'll get you in and take care of you. You can send private requests as well, message requests, and we will take care of you. Okay, wonderful. All right, that pretty much wraps it up for me tonight. Have a wonderful evening. God bless you all, and until next time. Gee, yay. All right. Thank you very much. All right, guys. Thanks so much for following us on YouTube. Until next time.